This week, people from all political parties, a wide range of backgrounds and life experiences, gathered together in one of the nation's most important places of worship, Westminster Abbey, to pay homage to what has arguably become the country's most important religion. I'm talking, of course, about the National Health Service. Seriously, Britain's National Health Service turned 75 years old this week, and while you might have marked the occasion by looking at its history, looking at people who have been helped by it over the years, what we saw was a service with people singing hymns and giving thanks. The George Cross, which was presented to the NHS by the late Queen last year, was brought to the high altar. The Prime Minister and the Leader of the Opposition gave readings. The royal family was represented. The sermon proper spoke of the hope that is the NHS. And indeed, a special 50p coin was minted to mark the occasion. Now, you can't control when a significant birthday comes along, but arguably this is some of the worst timing ever. I mean, the UK's misty-eyed romanticism of the huge bureaucracy that is the NHS was always, shall we say, a touch eccentric. But right now, it's bizarrely out of touch with the dawning realisation that things are really not going very well at all. I think this came about largely because of political history. So the NHS was a Labour initiative in the 1940s. At the time when it was brought in, it was a bold innovation with worthy ideals that framed what was hoped to be a brave new age. Aneurin Bevan, when he spoke to the first ever patient, 13-year-old Sylvia Beckingham, on the day that the NHS was launched, said that the new service was, quote, the most civilised step any country has ever taken. You could argue with that, but it was certainly a contender. Healthcare for absolutely everybody, free at the point of use. These are principles that have a huge amount going for them, with a few drawbacks, and those drawbacks turn out to be quite important. But then over the last 30 years, specifically since the government of Margaret Thatcher, Labour politicians and activists have always sold the message to the population. The Tories are planning to privatise the NHS. And the Tories in response have said, no, of course not. We don't intend to do that. Because they were afraid of the power of that as a campaign message. All of the polling showed that the public valued the NHS, and you messed with it at your peril. And the Labour politicians and the activists then also said the Tories are planning to underfund the NHS. Probably as a first step to selling it off. And the Tories said, no, we don't intend to do that. And every time the Tories brought in a new measure, austerity in the face of the financial crisis, for example, they would ring-fence the money for the NHS. And the Labour politicians and the activists would claim anyway that the Tories were underfunding the NHS. Because the nature of a health system is that you can always point at the things you can't afford to do and claim that this comes from underfunding. All of those things should be done if you're running it properly. How much funding is needed? More than they're currently spending. And that same answer, regardless of the context, will always work. Now, this dynamic played out over decades, reinforced with the public, even when they didn't accept Labour's argument that Conservatives were planning on privatising the NHS and voted them in anyway, that the NHS was precious and that it had to be defended. When COVID-19 came along, the principal justification given for locking down was to protect the NHS. I mean, in principle, to reduce the number of deaths by preventing health services from getting overwhelmed. But you didn't have to say all that. You just had to say, we need to protect the NHS, like the NHS was now granny. And we could reinforce the message by all going to our doorsteps and applauding their work once a week. And that's exactly what we did. The problem is that the NHS is demonstrably, irrefutably broken. Of course, that is nothing to do with the people who work for it, many of whom, and I know people personally on this list, but in huge and somewhat heroic effort in immensely stressful jobs that frankly often damage their own health. Do the best job that you could. But it's a huge sprawling bureaucracy. And in what universe do we think that such organisations ever work efficiently and well? For all that you'll find people in the country under the impression that the NHS is underfunded, the truth is that NHS funding is at pretty much record levels. The UK is ranked 6th in the OECD's list for healthcare spending as a percentage of GDP. It swallows up 45% of public spending. The 2023 budget was £160 billion and employs 1.7 million people. But for all that, it scores the second worst out of 19 developed countries for saving lives. Breast cancer survival rates, 15th lowest of 18. Colon cancer survival, absolute lowest. Lung cancer survival, one from the bottom. Worst out of 9 comparable countries for heart attack survival. It has 7.4 million people on the waiting list. People struggle to get appointments with their GP. There have been huge increases in late diagnosis for cancers of various types, with the consequences that you would expect. What then is the value of the promise, free at the point of use, if you can't get to use it because you're at the back of a very long queue? The argument was always, well, the only alternative to this pure and wonderful way of doing things is the kind of mess that they have in America. Yeah, sorry Americans, nobody wants your health system. The Brits are not the only ones with some hard truths that need to be heard on this, but that's another time perhaps. But it has gone to the stage where ordinary people are starting to notice, because so many of them are having frustrating or difficult experiences. A recent YouGov poll found that just 19% of people thought the NHS provided better healthcare than other European countries, and that 65% of people now see the NHS as basically a bad service. In the US, the problem is that significant numbers of people can't afford the healthcare that they need, and even those who think they're covered can find that they're not when they get hit by something unexpected and end up staring financial ruin in the face. Now, that doesn't happen in the UK. Whoopee! But instead you have a huge mismatch between demand, which will expand even further with an ageing and increasingly obese population, and capacity. So sure, no financial ruin, but whether you actually get the treatment you want and need can rather depend on a whole bunch of circumstances out of your control or even sheer dumb luck. You can debate until the cows come home which of those two you would prefer, but neither of the above is the option that people are starting to be at least a little curious about, maybe for the first time. And look, maybe this was due to happen regardless of how well the service was run, because things have changed. When the NHS was created, we could expect to live on average for 69 years. Well, that's grown to 81 years more recently. More people living longer means more people with the various ongoing ailments that come with ageing. Not only that, but as the Telegraph newspaper pointed out this week, in 1948 the population over 65 relative to the working age population was just 16.5%. Well, right now it's over 28%, and that number is continuing to climb. More and more older people having to be supported by the wealth that's created by fewer and fewer younger people. Oh, and rather a lot of them are fat as well. Very low levels of obesity in 1948. Well, I mean, war rationing will do that for you. But even by 1975, obesity rates were just 10%, which I think is still quite a lot. Actually, 1 in 10 obese, but it's a drop in the ocean compared to the 31% that qualify today. Unlike ageing, there's nothing inevitable about which way the trend goes from here on that, but it sure seems to be continuing in the wrong direction right now. So, yes, for structural reasons if nothing else. At some point you will have to do things differently. This is one of those areas where it would probably take a Labour government to be able to make a move on it, since they are the party that has worked consistently to become more trusted on the NHS. They will have more freedom of manoeuvre. That's certainly something that you can see some degree of growing awareness of. The Shadow Health Secretary, Wes Streeting, said last week that the NHS is, quote, a service, not a shrine, and has opted to take on what he sees as the vested interests of the British Medical Association, the doctors' trade union. Former Labour Prime Minister Tony Blair came out this week making the case for more private provision within the health sector. The observation that in many countries they achieve better outcomes with various flavours of a mixed public and private system starting to be obvious enough that some are thinking that now might be the time to actually dare to say so in public. Writing in The Spectator, Kate Andrews noted that Conservatives are by and large happy for Labour to be starting to get ahead on the issue. She quoted one saying, "We want to let Labour do it, then we can row in behind," which is a position only really available to those who have given up the fight and decided that they have resigned themselves to losing the next election. Former Health Secretary Sajid Javid called for a royal commission to look at other models of healthcare, which is another possible route to trying to address the obvious problems without falling into the party political point-scoring trap. But it would have to wait till after the next election. These are important initiatives because until recently you wouldn't have seen any of them. One former minister is quoted as stating the least best kept secret for the last decade. He said, "We all get that the model is broken and has to change. It's just that no one is willing to say it out loud." We have had rather a lot of obvious truths that cannot be acknowledged for fear of the criticism that would follow in recent times. It feels as though we might at least be entering a moment of opportunity where some serious discussions could be had. Because let's be clear, organising a government department to provide health services is a practical problem to be solved. Once it becomes an article of faith that can never be questioned or even discussed, you have lost the plot. And second, no health service in the world can provide all the health support for every ailment, however minor, with no constraints. The demand for that outstrips the supply for even the best funded health service. And particularly right now, when the NHS provides a range of services that could legitimately be debated as to whether they're suitable for free provision by the state, which would include, for example, some cosmetic surgery, breast enlargements, gastric bands to help people lose weight. It's not to say there's no case to be made for any of those things, but that's the point. When you have to choose, sometimes you have to make relatively hard choices. And if you're one of the people that loses out as a result of those choices, yeah, you're probably going to complain, probably pretty vociferously. But you either have supply constrained by policy decision, based on the quantity of good you can do, the seriousness of the suffering you can avert, and you have to have a system for measuring that, or you let it happen by default, where you refuse to prioritise, at least officially, and a whole bunch of people just fall off the edge because they were unlucky. That first option can sound cold, however you explain your criteria for what you're choosing not to support. Especially if it takes you into the territory of, for example, not extending an aged person's life by a few months with a treatment, since that can be represented as literally letting people die, even though the actual length of life obtained is short and probably not high quality. But the second option does more harm, because the act of simply running out of capacity does not prioritise those in the most need. It reliably hurts more people, because nobody is officially anyway, working out how to organise things to hurt less. That's what's happening right now. And you can point the finger at decision makers and blame them, but only by omission. Only because the system isn't working properly under them. Not because they took a deliberate decision that disadvantaged someone. And that's why so few of the political cowards are prepared to take the decisions that would genuinely make the system better. Make the system better, but unless you can make it perfect, people will always point at you and blame you for someone dying, for someone suffering. That's why we see Prime Ministers and would-be Prime Ministers worshipping in cathedrals at the holy shrine of the NHS. They are praying to the gods, most of all not to be blamed for its failings. We should celebrate 75 years by deciding we could do a bit better than that. Thanks for watching this video. If you liked it, please share with anyone else you think would also enjoy it. Word of mouth is really important to us. And if you've not subscribed yet, what are you waiting for? As the saying goes, that subscribe button won't smash itself.